Hello, my name is Elizabeth Walkden and I'm here to talk to you about my experience of completing a pre-doctoral fellowship. My background is as a speech and language therapist and I specialise in acute medicine and critical care settings. Over my career I've developed an interest in cardiothoracic surgery and in particular heart and lung transplantation. Previous to starting the pre-doctoral fellowship, I had completed an internship with the ARC-GM team, during which time I completed a rapid evidence review on the impact of cardiothoracic surgery on developing dysphagia post-surgery. And during this time, I also completed a master's module from the Clinical Research Masters programme at Manchester University, and the topic of this module was critical appraisal. This in turn helped develop my pre-doctoral application. Before this point, I'd also had one previous publication and I'd been involved in poster presentations. So I had some basic research skills that I wanted to improve. And that was what led me to the pre-doctoral fellowship. I really wanted to understand the kind of research world a lot better and improve my research skills and understanding. I was also starting to take on a much more management role at work and wanted to be able to support research conversations and embed it in our clinical practice. Thankfully, I was successful in the pre-doctoral application and I used that time to complete a master's in clinical research. This was a lot to take on, but I recently completed and I overall gained a distinction for this master's. As you can see on the poster, I put the module topics down and it was really helpful to gain an overview of research in lots of different areas, such as quantitative and qualitative, the ethics behind it, statistics, and just designing research in the first place. I'm hoping to create 2 papers from this dissertation that I completed for my master's. This will be a systematic review and a qualitative research study. These have already been written in the dissertation format and I'm currently rewriting them into a journal paper format. Another output of my pre-doctoral fellowship was that I was successful in gaining a clinical lead position in acute and critical care medicine at Manchester Royal and North Manchester General. And I was also able to create a speech and language therapy peer support group nationally for those working with heart and lung transplants. And this includes all the units across the UK. This is really exciting because it really does impact clinical practice, and a forum like this hasn't existed before. Obviously, we don't have time to do it today to talk through my whole dissertation, but the objective was to assess the feasibility of collecting pre-lung transplant functional ability and frailty scores in the NHS setting, and to evaluate the data for associations between pre-lung transplant scores and the development of dysphagia post-surgery. And this is with the hope that a doctoral application would be for a multi-site, larger scale observational cohort study. So my systematic review for the dissertation was to understand the current evidence that's out there on the impact of cardiothoracic and lung transplant surgery on the development of dysphagia in the adult population. So this included 11 studies and had a critical appraisal, and it showed that there was a lack of evidence in this area. My quantitative research study was an observational cohort study using retrospective data collected from patient notes on the transplant unit. The main aim was to see if it was feasible to collect this pre-transplant data, which it was. 3 out of the 4 functional scores that I chose were 84% complete, while 1 was 17% complete. The secondary research question was scoping hypothesis for a larger scale about if functional ability pre-transplant predisposes you to developing dysphagia post-transplant. However, no associations were found in the results collected. So thinking more broadly about the pre-doctoral fellowship and the benefits that I feel it's had, I feel like it's impacted not only me but patients and the team that work around me. I have a much better understanding of research and a better confidence in delivering and implementing research. And this in turn has helped me support others, even with simple research-related tasks as well. It's also helped me in my recent job application and given me an awareness of the research world and how it functions, including opportunities for the future. It's also shown me that clinical research is possible. And this in turn has improved the care that we're able to provide for patients. If the speech therapy team in Manchester are able to produce more research, that then means improved potential outcomes for patients. And then finally with the team, I think it's allowed me to be a better role model for my team with regards to clinical research and helping them with kind of even just audit support. I've been able to signpost people to opportunities that are available from the ArcGM and NIHR and wider research world. And it's helped me embed kind of research skills into all of our clinical practice. So things for the future, I think I'm going to be spending a little bit of time settling into my new role as clinical lead and supporting the MDT with research. I'm going to be submitting those papers that I talked about earlier, and I'd like to pursue some kind of clinical academia. I think that there is an application for a PhD in my future for a multi-site study following on from the research that I did in my master's. I'd like to say a special thanks to Sarah Wallace, Sorrel Burden, who are my supervisors, the Withenshaw, SLT and transplant teams, and in particular on this call, who is Laura, the physiotherapist in the transplant team, who helped me enormously with collecting the data. Thanks.